In Soroti city, 292 kilometers northeast of the capital, stands this conservative colonial facility built in World War times. Initially built to treat World War soldiers, Soroti Regional Referral Hospital became a district hospital in 1978 and a referral hospital in 1996.
In the late 20s, this hospital was started as a center for treating patients with syphilis who were coming from the First World War. You see that building there, the red building, is the first block in this hospital. So from then on, other buildings were added as a general hospital.
You know, it's still linked even to what is going on now. Because even the World War victims and all that, these were mainly people with different forms of trauma. But still, I think we're still carrying on with that philosophy, that aspiration.
It remains a key treatment hub for 10 districts in the region, including Soroti, Amuria, Bukedea, Kaberamaido, Kalaki, Kapelebyong, Katakwi, Kumi, Ngora, Serere, as well as Soroti City. But according to the hospital administration, the facility is overwhelmed by large numbers of patients flocking it from neighboring regions that depend on the facility.
Because of different specialties which are here, you'll find people coming from other sub-regions. Even Achole, even from Lera sub-region, even especially Karamoja, which is not well serviced in terms of medical services. They come here.
Despite challenges in securing accurate statistics, it's estimated that the hospital, which is one of the country's 15 internship hospitals, serves over 3 million people. It's a 274-bed facility with 264 medical workers, 19 contract staff, and just 12 of the required 30 specialists taking care of the entire region.
You may have so many people at whatever level, but if the commanders at the forefront, the surgeons are few, the specialists are few, that is where the problem is.
The hospital, in partnership with Health Rights International, has just concluded a surgical camp funded by ICC to operate people living with injuries sustained in previous wars, but lack of staff and sufficient equipment were visible. This X-ray here has been down for around 10 years, and this mobile one, with its limitations, was donated in 2021 to do chest X-rays for COVID-19 patients. Now, with the fall in the number of COVID-19 cases, this is the only machine that the hospital has, but it can't handle the demand.
So it means we spend a lot to take patients out to access those services before the surgical procedures can go on. So that's an extra cost. Of course, it's an appeal on the side of the government that Soroti Regional Hospital, with this bigger catchment area of the TESO and beyond, will require very urgently to have those as the very basic.
The facility's principal administrator, Bezi Omoya, attributes the success of the hospital to dedicated staff like this man, Joseph Epodoy, most of whom are born in the region. The hospital also grapples with breakdown in utility facilities, limited structures, and lack of space for expansion, among others.
Our mortuary is only able to keep 2 bodies, but also it is in a bad shape. It is not functioning as we talk now. We take bodies to private hospitals.
Whether it's a heart transplant, whether it's a kidney transplant, it can be done here. So long as you have we polish the skills, we have the equipment, you can still do it here. You don't have to go to, I've been in India where they do kidney transplants. This environment is even better.
The hospital has plans to shift to Arapai sub-county, and the current structure will be left for the city, and there is a loud call to government to expedite the relocation process. Muhumuza, NTV.